scheduled anytime soon?
Well, Virginia has a new resource to help answer your questions about the safety, effectiveness, and recovery from the most common procedures.
Never thought it would happen. It was the last thing I ever considered in my life.
Sandra Rollins was diagnosed with stage 1 intermediate breast cancer on June 30th, following a routine mammogram. She had an outpatient lumpectomy a few weeks later on both breasts.
Doing your research ahead of time helps a lot and calms a lot of the fears.
It's why Rollins is happy to learn Virginia Health Information just released this online guide for outpatient procedures, which account for a growing number of all surgeries.
The idea is to get people most comfortable with their procedures and help them talk with their doctor.
VHI Executive Director Michael Lundberg says all patients need to do their homework. Joan Rivers' sudden death last month raised concerns about procedures done outside a hospital, whether they're part of a treatment or they're diagnostic.
While they seem like they're less serious because there's not an overnight stay, it's important to understand there's risks and benefits.
Rollins knows this is a valuable resource for any patient facing the unknown.
You have a lot of questions, a lot of things that come to mind, and maybe having one place to go instead of making phone calls to everybody would be a good reason to have it.
Now, you can head to WRIC.com for a link to this database. It includes a lot of information, including the 10 most common outpatient surgeries, facilities where they're available, even some alternatives if you don't want to have an outpatient procedure.
And that's fantastic, because when you go home and you're by yourself, I'm sure you're wondering how you're doing as you're getting better. And of course, beforehand, it's always good to know what you're getting into.
A lot of information all in one place.
All right, thank you. Good job, Amy. Like that.